Actually, the Arabia, who ye pa. Afi 2022 mo ekum nipa be 6008. Sanso na 2023 no ekum nipa be 5097. Mema akwa de ba Axe television so apomde pamre na aso no. Ena no ebeka sa fa yare achidi ho abro nika ne se malaria. Na malaria kra eno ne yare ben. Eden na deba ena se obi enya malaria ni bia nsusu aso ben ena wo onimpdia ne so. Enu ti na makofa Dr. Francis Amoako ono na ne ne ba ba twetwe enkomo. Na djuma di makobi ena asomase Axe Media Practical Institute or say fancy djuma hon kwa dia bra no de 3 to 6 months ebesi won mama oda yeso abam me a me bedi djuma di ho cha me di ane ma me ya yetwa ye ho aba ye ba ye de nkomo twetwe e ba hihye so.
You welcome to Axe Media Practical Institute, the best media school in Africa.
Axe Media Bisakeke, ya the Bema, Axe Media Bisakeke, near the Bema, within the Yamanka Ajmamine Kofabai, or Penimpa Meda Axe Media Practical Institute. Parliament of Nesedica for name of Yabaye, a Yemfield any Emilie. Mika say 2024 and 2025. A year. Yeah, admission as I said that and tell me we are way yeah juma 24/7 non-stop. O should say I will come say I want to share so I want to run about banners Busa Royal TV then more na benya Axe Media Practical Institute for never found forms now also so die so person you ebam na yekopie won kramu a enye ba bia ne say achi mota ABC junction ni opposite o cross road no overpass na obaba beto eho ene yewo on top of Gawura Bank eho na Axe Media Practical Institute yewo beda mu nyina ase say o ma mbre ene adade ehwe mi ewo television so odonfo dom ye na da fufuro me ne wo ye besa hia ewo haya bidin dia mankwa agima makramo. Bye.
Axe Media Practical Institute. Bisakeke na yedi bemao.
Akwa ba bi ma de ba Axe television so. Safe na wo de wa fidie na to anum sa na ye apom de pa. Se na mdi kan kan na e ba tutu nkomo afa ye yare malaria ho. Ene Dr. Francis Amoako ene ba tutu nkomo. En chimpling doctor na ye nse nkomo tutu na ase. Doctor, ba che ma akwa ba.
Mejiro so.
Ayo. Doctor say ka say ati di yare and only a yarebe.
Okay. See, in the kind of medical chair, material from my hair for Nina. Na yaka malaria na setudi area, a yarabia, a hard jump, na if we a more and tuntum. Na the almost band a whole lot of process I go through, but basically from malaria is from the insect mosquito, and then plus more than my eye or malaria and no one ma yenya sa malaria yare no. So
okay. Number 2 then adeba.
Okay. So some say the kind no. Malaria is from the mosquito. And then with the mosquito you have various forms of mosquitoes. You different kinds. Make was my beche. But basically from the Anopheles mosquito. And Anopheles mosquito so you will move 2 types. You will move a man and mema. Now a man warm and on malaria no. A mema no warm ndidi e woni pa ho na mo amudidi wonua ho. A man no ehia moja ai funi pa ho e de awo. Enti no se warm e twe wo de no. Omo twu moja no. Na omo e ma plasmodium yare no. Na ansa na obenya sa plasmodium ni bi no e wo se ono nso so di kan ekotwe obi a wo malaria ni bi eni moja. Na ono wa betwe wo de no e de akoko wa wo ma no na ono so year exchange so with all blood no so more plasmodium. So that's basically how the whole malaria process goes on.
Number 2 and tuntum na o kan ho asem sisi a no say omu hwan obana na asebe man ne ma yare no
obano and ma yare no because obano in tuntum they need blood for reproduction. Okay, so or by between Mujan on the or the quack woman. Now, so watch or some more baby. But I know by the corner of the man and one plasmodium now. A baby cause malaria area.
Doctor, Nasa Abuano. Time ben or this area.
Time ben. So mostly Omo very active during innumerable. Yes, during evenings and also Omo moving around a lot during rainy seasons. So during rainy seasons like an year this current our current data you mean, and then in the evenings that time I'm very very active.
Ah, okay. Doctor, and then so obinya sa atidi yare na. And then a man say nipa wenya atidi yare.
Okay. So and on there are a few simple things to know say this is malaria. Aside testing, so because I'm on malaria, I just say be a one. No why secondly, no honam ni na be na ya. Na fi no ho popo. Na fi will be lose appetite. The way I know CDD first no won't mean say DD biom. I say if you understand new pounds won't mean DD. Now fi no so say a cold very severe. Hono nimboja it's also estimated. Now fi estimated na seizure. So at times say yeah patients on more seizure no. Almost make it test for malaria. I check say any malaria na cause here because it's me cause malaria ni. Yes, so these are a few symptoms I show say nipa ko be in malaria.
Ah, okay. Now, sa malaria a sign.
Malaria and sign. Say I just say aboa ntontom no. Actually if you be ho abawo ho. Na on pakono che fi ho or say one so e wo malaria ni bi. Ansa na wo a ye de wo ba betwe mo muja no. Ono so enye bi.
Enti woni bi kra na say aboa no ka okra na wunya yare ni bi.
Say wu ni bi. Na say aboa no edi kan akọ obi a owo bi akwatwe ne moja. And so okay, so you find say initially no mosquito is not infected, but everyone say minu ate hey wo malaria. Na say ono na ba ho ba betwe moja na malaria wo mu no. Na say wa betwe mo ne bi efi wo ho. Na afi oba meme ho mi bi. Na wa betwe moja. Nti wa twe mi moja no. Or they will make exchange. The exchange now will make no. Ono no twe moja na ono so mame. Ya boani bi abona obekose ya renu wo memu nti mi amini bi no saa na saa kwan so metimi ye bi
say aboana kawa edi how many days and months and years and sana sa malaria ya le no wanya bi.
So initially one feel it share but within 14 to 21 days you start having the manifestations of the symptoms of malaria within you.
Akwa be so na first we see sa malaria ya le ko.
All right. So very important. Yeah, na yeboa malaria ekoso. So there were various ways of controlling or preventing malaria. There were chemical ways, there were mechanical ways, and there were natural ways. So chemical ways, no, mosquito sprays, no, you use, no. So either mosquito spray and I say coil, mosquito coil, and I say mosquito repellents, no. They are all mosquito repellents, but just states now on and difference the woman. And then the mechanical waste, say minu and then abwa ama malaria no eswate. When no, they grew in water, right? So it will be very advisable say yenja insu siho abrayen kataso. So we should always make sure that all our water bodies are covered, and then also there shouldn't be any form of dirty water, cause ehona omo etimi enyi right. And then with the natural ways ehono na etimi she anka hono anka awo ne hono no na ni pampan as ni smoke no etimi repel those mosquitoes to prevent them from transmitting malaria. Yeah.
Okay. Now duma bena sa abo antontom odi ewo malaria ne spread mo.
Alright.
Ne trem.
Is a medical can say malaria the female anopheles mosquito or no and no cause malaria. No. So abo antontom no one na or carry the plasmodium to infect other people with the malaria. So that's basically the role of the mosquito in the transmission of malaria.
Okay. na sa atiri yare obia na timinya e na se nipa kro ni nya nso a eya ehu pa
obia timinya bi se akola ya won nye se mene obi no yetimi enye kakra ene obia panyimu a wodi be fi 90. Now though we are all human beings, but classes be or her say malaria and china are very dangerous, and only a fire willing and from age 0 to about 5 years or even to 12 years, a very dangerous. Say akula obi benya malaria within that age. So obiba to say obi be a pharmacy. So if a child comes to my pharmacy and then presents with malaria, I treat it as a very serious case if the child is from age 0 to 12 years. And then also if the person is an adult, like an old age person, if he maybe a 70 years old. So the reason is that those age groups, our more immune system, they're very, very weak. So with that, to be able to clear the malaria or to even have its own body fighting against the malaria, no, better than kakra. So ubia timinebi, but there is a bit of severity when it falls within age 0 to 12 or children or infants, and then old age or geriatrics. Yeah.
Okay, doctor. Now, sir, chronic fine. You have some bear him fan. Okay. And a malaria and a pa.
Right. So malaria no, abuan tontom no. They mostly omo mechanics omo thriving and as omo niye. Oh baby in so a tire. Right. And the baby a show so. This is about Africa ha. If baby sub-Saharan part of Africa, which involves Ghana with Nigeria, with Congo, basically the western part of Africa, right? And then you call outside Africans as well. The southern part of the world or the globe, which is Southern Asia, Southern America, Brazil, Spain, like those kind of Southern American countries. There is a high prevalence of malaria within that side of the globe, and also in parts of Asia as well. Yeah.
Okay. Apumdi pajumadi ena wani guso awoshe nene yakasafa yare a 3D yare hon. Ene Dr. Francis Amwakon ene edutrain komo. Na jumadi Axe Media Practical Institute. Omono maso masne mame de bro. Ose se fan senjo juma hon kwa de abla. Na mo de 3 to 6 months ebesi wonom. Ama wani so ade hunu abam. Me amidi jumadi o chan me di ane mame ya. Kasa kosi se ehemfa ena ye atidi yare no baby ewo ho pa ai nti yen semre yen samtwi me doctor na yen to aso. Okay doctor. Answer na yebe kon.
Yes.
Ye bisa se ehemfa na atidi yare ewo pa e ma wo chile.
Yeah.
Sisi an ye pesi ehun se obinya malaria yare na e kwan ba eso na ye fa so ehun.
Okay. Okay. So, first of all, by my facility with symptoms, no. So, I prefer be signs and symptoms. So, symptoms near woba be country me. Say, oh, be a doctor, me tia me ya, me honam ye me say. Now, you know, yako meki, yako check signs. So, the signs are what we will test for. So, a honor a day lab in your baby. So, either say, yeah, would be a friend rapid diagnostic test. And on a small white cassettes be now check it. So that one is a very simple and fast approach to determine whether a person is suffering from malaria or not. And then the deeper one, which is done in higher facilities, is the blood smear or use microscope. It's a lab technologist check it. So they will take a sample of your blood. No much no microscope per se. No much check it say plasmodium maybe homogemo. Then they make their calculations, and then from the value number, that is when we know the type of malaria you have, whether severe or unsevere malaria.
Na say oba pain for so nya say arena also ehumana
na because initially, first of all, wo oba no say okay, so ye oba no and number for no shinifun, so 2 people involved, right? Now wo maame na akra no show fun wo maame na kasa no ebi mo frɛ so be a pregnant at times almost catch and say oyare in a way, and just oyare but oyare in a way that it means the human body now it has become weak, and she's at a risk of anything, whether severe or unsevere. Now, malaria in a pregnant woman is a very, very, very serious case in this country. Not only in this country, but a very serious case in the health fraternity. So it's a very important say about pim for a professional way for making sure say malaria and so because of that they have medicines to prevent malaria in pregnant women, drugs specifically made for pregnant women, and also antenatal. So they also advise you how to prevent the malaria, sleeping in insecticide treated nets, and practicing safe things at home. So it's a very important thing in pregnant women.
Okay, your question is chat.
Okay.
Nema be ni gu akwan mu a ye de sasa yare.
Okay. So I'm in the pharmaceutical field. So in the pharmaceutical field we have different forms of therapies. We have the orthodox therapy and the traditional or natural therapy. So the traditional ones in the use, and then the orthodox ones I can speak more about the orthodox ones, where we have the artemisinin and lumefantrines. I wouldn't want to mention brand names on this platform, but that's what we know. Artemisinin, lumefantrine, and we have dihydroartemisinin and piperacin, a whole lot of different brands of anti-malarial therapy, primaquine, a whole lot. So, and aside that ones, we have different plants that we can use in managing malaria, which I can't really say much about it.
Okay. Now say, see I was away or pharmacy field.
Right.
Okay, so when you malaria now, a yes or by self medication.
Okay. So one thing in the pharmaceutical or even in the health fraternity is self-medication. Now, you may be presenting with signs and symptoms of malaria, but it may not be malaria because it can be like, say, baby, it can be like malaria, but any malaria. Okay, so it is best or it is advisable say you better text it and sana indicate say oh yeah. So we wouldn't advise self-medication. Yes, so we would advise that everybody can test it. Then we will confirm the presence or absence of malaria. They will know what to do afterwards. So if it is positive, we will treat malaria. If it is not positive, we look for other means to find out what is going on, and then we move ahead with it.
Okay.
Yeah.
At what stage? And I only say actually I can say I son I uncle.
Malaria is treatable, so it will only be untreatable if you be in Igusu. So it's in different stages. We have different forms of malaria, the uncomplicated one and then the complicated or severe ones. So the uncomplicated ones now we mostly present with the one near Mfound Corda Hospital. It's the normal ones. Nothing of that time. No, they are uncomplicated. But the complicated ones, no, the signs and symptoms are different from the uncomplicated one. A honey anemia like umuja a hona a seizure, a hona will be a bit akoku mampo. So those ones, if say I'm making immediate and prompt response to that severe form of malaria, that is when we can actually lose the patient's life. So it's important that once you realize that you be your system now, then you make the necessary approaches to controlling whatever is going on.
Okay. Now malaria needs me kum.
Yes, kum. It's not different forms of malaria. So the severe ones can easily kill you. Yeah.
Okay. Doctor,
yep.
Your best way, your best to a funny for kaka.
Okay. So that's what so it's our main aim say you bear two malaria say crack all over the world, and say ebe ye ejina many way so say one year with ye unless one you make you with fear. There's no way say Ejuma World Health Organization and even Ghana Health Service and as Ministry of Health I'm just debating if possible. So let's do our very best, right? And then say you show if you any abortions so the way see di hon kon say bia isu or na ngura bi wo future bomode anedo because I hold one tontum fever. Now malaria and if you want tontum no and the money pa. Into no in what they are say you be control those measures. And also if you feel say you're not feeling well and tampana any health facility, say pharmacy, say hospital, and then I'll make it start checks now. I wouldn't advise self-treatment. Make sure you are tested. So you test and then we treat, right? And then let's make our health a very important thing for us. So this is the few I like to say, and I'd like to add to whatever I came to share with you guys here today. Thank you.
Ahana brebe ma yakwan me di dwumadi asi. Me am di dwumadi bro me di ane ma me ya. Axe Media Practical Institute and a soya, and the dwumadi ebro. Ye ko dasene ye basa so hia.